Hi there everyone, hope you're all well. I'm here again today to give you another little educational tutorial for what is physiotherapy or equine physiotherapy. In particular, I'll do a separate canine one because I don't want to confuse everyone and try and intertwine the two within the time limit for uploading videos. So, like I said, today we're going to talk about equine physiotherapy and the benefits of physiotherapy in particular, conditions that we treat, what else? What I include within my physiotherapy sessions as a physiotherapist, so what I go out and do with every single client of mine, and also who do I treat, what type of horses do I treat as my client base, really. So I'd like to start off by describing a little bit of what physiotherapy is. I provide physiotherapy off-site, so obviously I've got my hydrotherapy centre, so I do allow any inpatients that are currently in with us that I can give them physiotherapy obviously within the centre, but my other clients I rather go out and treat at home or at their own yard, as normally they'd have to travel a distance to come to the centre, and I just don't personally feel that it's as much of a benefit to them by travelling to me, because they've got to get back on the lorry and stabilise themselves all the way home, so you're kind of defeating a little bit of the object. So I always go out to treat my clients at their own individual yard. So if you don't already know much about me, I've graduated from university with a master's degree in veterinary physiotherapy. I'm also associated with the National Association of Veterinary Physiotherapists and also the Register of Animal Musculoskeletal Practitioners. So that's who I'm associated with, and you'll find when you go and look for a physiotherapist that it's always good to ask one, their qualifications and who they're also associated with. So yeah, do that if you can. It's always best to find out so that you can have the best service possible. Okay, so physio is a widely used modality for animals of all abilities. So whether it's your happy hacker to your Grand Prix dressage, Grand Prix show jumping, 5-star eventing horse, you know, all horses need to be maintained. You can use it pre or post surgery and injury as well, and also whilst horses are on box rest. So lots of people think that whilst their horse is on box rest, there's nothing they can do. Actually, it's quite the opposite. We can do quite a lot with the animal with minimal force and torque going through the joints, just to help keep them a little bit more comfortable during box rest, because it's a bit like you being in your bed for X amount of time, and just try and prehabilitate them almost, so that when they can start doing their work, they're at a better sort of level, if you like, of being able to produce that work. And with injuries, you get lots of sort of asymmetries and things like that going on within the body, and compensation issues. So it's really great from day one to try and minimise those compensations and any discomfort going on within the body, which will help progress that rehabilitation at a later stage. So we deal a lot with horses who have musculoskeletal imbalances. And this can be anything from a horse who has had a very minor injury. You may not have even noticed. It might have been a tweak out in the field and they just slightly compensated a little bit of weight over to the other leg, and you might not know any the wiser that that's happened. They're not lame, they're not stiff. You know, it's a bit like us if we go down the street and we just twist our ankle on the pavement, you know? you just, for a little bit of time, compensate back over to another leg. It's exactly the same with animals. Also, yeah, so the body weight of the horses is 60% of muscle weight. So for the horses especially, prevention is a lot better than cure. So your muscle in the horse really supports all the limbs, the bones, the ligaments, the tendons. So making sure that those muscles are in tip-top condition will really help all the other structures stay nice and healthy, and make sure that your horse has the longevity of its career, or whether that, like I said, whether that's hacking or being a top athletic horse. Also, what you do find in these areas in the muscles which do get tense and compensate and things like that is you can end up with quite a lot of muscle spasms through the tension. And also that creates a whole chain effect through the rest of the body as well. So the origin of the discomfort might come from one place, but quite often it then continues up through the chain into other muscles as well. So that's how I was saying, like, compensation, it might just be one tiny little thing, and actually it impacts a lot of the chain going through the horse. And obviously that can be uncomfortable. It's like when we tweak our back, I've had muscle spasms where my whole left side of my back completely locked up. I could barely lift my leg, and then I ended up getting sciatica all the way through my left side down into my hamstrings. This is exactly the same for the horse, but they can't speak. They can't say, ow, this is hurting, or oh, that doesn't feel quite right today, or all these elements that we look at as physios. So as a physio, your aim, and through your training, you should be able to identify that through a static assessment, a dynamic assessment, and also palpation and touch of the horse. And all these kinds of things can impact the movement of the horse as well. And so it will ultimately have an effect on their performance and their physical well-being. And also looking on the outside of the box as well, not just from the horse itself, but you've also got other elements that may affect how they perform, and how it affects the musculoskeletal system. So tack, variety of exercise, so what you kind of do with them on a weekly basis, monthly basis, all those kinds of things. Bits, riders, rider balance, rider weight, all these different elements they all feed the musculoskeletal system. So a physiotherapy session is tailored for each individual horse. I generally work through the same sort of principles for each horse, so my strategies are all the same for what I go through and look at with the horse, but no horse is the same. So when I go to a horse, my first thing is obviously speak to the owner, take a history if the horse has been injured or out of work or in work but not performing as well as what it has, all these different elements. Your owner is key to understanding the animal and how they're acting. So that's my first port of call. I then look at the horse statically and see, how their conformation is, how they're holding themselves, weight distribution, all those kinds of things. I look at muscle evenness and things like that. And then I also look at the horse dynamically. In most cases, I look at them on the flat, on a straight and on a circle on the hard, and normally a rein back as well. And in some cases, we also do look at them on the lunge and look at them ridden as well, all depending on what sort of feedback the owner's given me for the history of the horse and what I feel is necessary. what you must understand also is that a therapist is going in. When you first go in as a therapist, you're there for an hour and a half maybe, and you're getting a lot of information all in one go. So quite often your therapist might not have all the answers that you want on the first go. It might take a couple of sessions for them to build up a picture and a story of what is going on with this horse. What's repeating itself on the next session? What's changed? What's got better? What's got worse? You can't expect a whole answer in just one session, and you certainly cannot do a magic trick and all of a sudden this horse is just fabulous. It doesn't happen like that, unfortunately. We wish it did, but quite often, you know, it might take 2, 3, 4, 5 sessions for your horse to actually make a big improvement. Like I say, every horse is different. So once we've done the dynamic assessment, then I normally palpate a horse. So I'll feel from head to toe, to head to tail, to toe, all the way through the body. So for that, I'm looking at the how the muscle reacts underneath my fingertips, how the tendons feel like going down the limbs, how the feet feel, look at hoof conformation, is there anything going on there? You know, all those different elements. So that's what I'm looking for when I palpate. Then I use soft tissue, massage, mobilization techniques, stretching, all those kind of areas that we use as physios, trigger point therapy, acupressure, all those things. And then also I do use electrotherapies. Normally at the end of my session I'll use an electrotherapy if I feel like using manual therapy hasn't got quite enough out of what I wanted to get out and get the muscle to release, if you like. So then I'll use an electrotherapy. For me, I have a class 3B laser which I use, a pulse magnetic field therapy unit which I also use. I've got a therapy ultrasound, I've got a TENS machine, NMES machine, so I've got most of them, but it's not about what you've got, it's how you use it. And you don't always need to use electrotherapies. If I feel like I've achieved what I wanted to achieve with using my hands, I won't go in and use electrotherapy because I don't need to. So it's not the fact of I've got it, I'll use it. Sometimes less is more, it really is, and allow that body to react and change to what's just happened. So that's my personal view on electrotherapies anyway. What else? So after this, so any stretching or anything like that needs to be performed. I'll also show the owner anything that I feel that might be good for them to use as well. And then I also then discuss going forward with the owner how often the horse may need to be seen, and also exercises, so therapeutic exercises that we're going to do. I then email the owner later on with the exercises that we've discussed. And it's really important to know what your owner can do and how much time they have, how often they can do things like this, because if you bombard them with a load of stuff and actually they can only ride 2 times a week, no good, you know. Like I said, less is more sometimes. Okay, so some of the benefits of physiotherapy are decrease in muscle tension, like I said, and muscle spasms, identify muscle imbalances and weaknesses and overdevelopments. So sometimes it's really focused on the weaknesses in a horse, but with weaknesses come overcompensatory issues. So one muscle might be underdeveloped and the other muscle might be overdeveloped. So it's really important to have a look at these sorts of factors as well and how we're going to change that and help the horse even up a little bit more. Main goal, always decrease pain and discomfort. Number one goal, always, regardless of the horse. increase range of motion, increase and improve mobility and extensibility of soft tissue, and ultimately, end goal, reduce the risk of injury. That's always our goal. And obviously to help improve performance as well. So some of the conditions that I regularly treat, back pain, that's one of the most common ones I always get. Change in behaviour, that often links in with back pain, but also pelvic issues as well. Anything from sort of lumbosacral, well, what do the vets call it? I've had loads of different referrals before for a lumbosacral issue. Let's just call it an issue. Sacroiliac, what else? Ligament injuries, yeah, they can all affect the back. Lamenesses all affects the back. What else? Fractures, locking stifle, that's always an interesting one. Muscle strains, muscle tears, muscular asymmetries. Arthritis is another big one, which really benefits well from correct physiotherapy. Post-surgical rehabilitation, so could be any sort of operations on tendons or ligaments, post-steroid injections, kissing spine surgery, you name it, we do it. Sporting injuries, yeah, literally the list goes on. It's a massive list. I can't really say all of them because there's just so many. I mean, list how many injuries a horse could get. Yeah, there's a lot. So yeah, so those are sort of the things that we treat and I treat. And like I said, I literally treat anyone from a happy hacker, non-broken horses I treat, 1, 2, 3-year-olds that haven't been broken yet I treat, just so that we can start from an early age to make sure that they're going in the right direction from the very beginning. And also top level performance horses as well. They all need help. They all need seeing. If you think, oh, my happy hacker, God, they'll be like so under muscled compared to the performance horse. Honestly, some of the performance horses are less developed than some of my novice owners' horses who do low-level dressage or low-level show jumping. So honestly, they all vary so much and every horse is different, but it is a job that I absolutely love doing because every horse is different. And it's so rewarding seeing the differences in the clients and the horses and seeing how much more comfortable they are. Yeah, it's just great, and I love it when the clients give you a text and say, oh my God, the horse is feeling so much better, they're doing this, they're doing that, they're not bucking anymore, they're not all those kinds of things. It's really a rewarding job. So yeah, so I hope that gives you a bit of a better idea of what physiotherapy is and how it might help your horse. Yeah, I think physio is a great thing for all horses, to be honest. I'm not just saying that because I'm a physio, because I used to have it for my horse before I was a physio, and I used to have it regularly as well. Because I just think they're all athletes at the end of the day, no matter what they're doing. If they're being ridden, then for me, they're doing something that's not normal, not natural for their body, and therefore they should all be classed as athletes. So that's my educational tutorial for today. I hope you enjoyed learning a little bit more about physiotherapy and what is used in physiotherapy and who we're aiming for. Oh, also one last thing. Make sure whenever you book a veterinary physiotherapy or physiotherapy session, insurance as I said before, qualifications, associations, insurance, and make sure that they ask you either to get your vet's permission yourself, or they ask you for your veterinary details so that they can gain veterinary permission to treat. Under the sections 19 and 20 of the Veterinary Surgeons Act 1966 and the Veterinary Surgery Exemption Order of 1962, it is illegal. So legal, we are not covered by insurance if we do not follow it. It is a legal requirement for any, that's not just a physio, any massage, osteopath, chiropractor, McTimoney, all of us, we have to obtain veterinary permission to treat that horse, okay? So every single horse needs it. So there we go, that's that little rant done. So yeah, I hope you enjoyed the little session tutorial, and I will speak to you next time. I'm not sure what I'm going to do it on yet, so if you have any suggestions, then give me a shout. Otherwise, I will see you soon with another tutorial. Take care, everyone. Bye.